Hi, my name is Brian Alvarado, and my presentation for toxicology is the toxicological analysis of the dietary supplement, also known as ashwagandha. So, what is ashwagandha? Ashwagandha is the Withania somnifera plant, an evergreen shrub that grows typically in Asia and Africa, and there's evidence to support that it helps with stress. But it was originally used as an adaptogen, a type of medicine that's supposed to help you accumulate the stress or any type of current situation that you're placing on your body and basically make it seem like it's a normal bodily function. Which there is not a lot of evidence that to support this, by the way. Um, but it does have a calming effect for your brain. It reduces inflammation, blood pressure, and even alters the immune system to give an increased response or even reduce a response depending on the situation. Now, the traditional use for as an adaptogen was just for anxiety, stress, maybe insomnia, and people even use it as far as to adapt to the stress of being infected with COVID or even adapting to the stress during the pandemic. Now, the average dosage for adults is 1,000 milligrams daily for 12 weeks, but there is some sort of side effects associated with the fact that it can affect you if you continue to use it in the long run. Now, ashwagandha is possibly effective for helping people with generalized anxiety disorders. That's supposed to help with day-to-day or persistent anxiety and help reduce it. It also helps with insomnia and with improving the quality of sleep and how much you get a day, and even help with stress related to your day-to-day activities or even stress-related weight gain, which is why it is typically used by people right now for if they're doing workouts or they're just trying to get accustomed to the fact that they may be overweight and there's a lot of stress associated with that. So it is gaining popularity amongst people who are doing workouts or have to get used to their body as far as things go. And there are other uses for this, but it has not been supported yet. Now, as I mentioned previously, there are many different uses. Now, these are just a list of what we think it could help for, but then again, we don't know exactly how it would help because there are different compounds in ashwagandha, and we have not studied the chemical process that goes inside of our bodies and how our bodies metabolize this sort of supplement. So, all of these that you're seeing right now on this slide, it has not been supported yet and more research needs to be done in this area. Now, there are some side effects, of course, associated with this, but they're not entirely known because we haven't studied the long-term effects of ashwagandha. Now, there are some symptoms that have been registered by patients that include if you're taking it orally, it usually upsets your stomach, it causes diarrhea, vomiting, and in rare cases does it create liver damage that may even be as severe enough that you will need a liver transplant. Um, and this is currently an issue that's currently being investigated with as reports are being increased. And as for skin application for lotion wise, we don't know yet. And so it is possibly safe, but as you can see on the ore side, it's not doesn't seem unlikely that there's no side effects for that, at least as far as we know. Now, the research article that I was looking at investigated a deeper insight into the liver damage caused by ashwagandha. As cases popped up in Japan, Iceland, India, and the USA, researchers decided to investigate a case of a patient that was admitted into the hospital with jaundice, in which the patient had disclosed that they were taking the ashwagandha supplement. Lab test results showed an increase in all these different compounds, and researchers linked it up to possible use of ashwagandha and try to find treatments that sort of aid the patient in recovering from such an issue and try to link it back to that dietary supplement. Now, as for testing this itself, the researchers used an R value assessment that indicated hepatocellular injury. They took urine samples for 24 hours and were able to see that the amount of copper that was being excreted in urine was twice exceeded the amounts that they were trying to look for twice. The condition of the patient improved after some parameters for that they ran on the patient, and they were able to link it up to the fact that ashwagandha was leading to that liver damage and suggested that they look even deeper into this and try to finally confirm that this supplement does cause you liver damage and that more research needs to be done and patients that are taking this need to be monitored for such injury. And this is the graph itself that they use as a RUCOM scale um, that was scoring the liver injury by ashwagandha that proves that the patient exposure to ashwagandha was actually the culprit behind the liver damage. As you can see, as they were hospitalized and they were looked at for treatment, that damage was severe. But then when they were denied the other medications and even alcohol, the absence of ashwagandha um, lessened that liver injury, and it was brought back when that patient was trying to take it back up again, which simply proves that fact that this is something that we need to look out for, a side effect that is rare but is possible. Now, there are some precautions for ashwagandha. Um, Orally, it is safe for up to 3 months. The long-term effects are unknown, but as I mentioned before, there are side effects associated with this. For skin application, it's safe for 2 months, and after that, we don't know about it. Now, if you're pregnant or planning to be pregnant, it's best to avoid this. Now, it has led to several miscarriages in pregnant women and has affected um, things such as breastfeeding as well. So, if you're pregnant, you don't want to take this. And there are ways it can even affect disorders, diseases, and even surgeries. If you've just recently taken a surgery, it has been shown to slow down the central nervous system. It has been known to increase your immune system response um, to some diseases, and after surgery, this is reduced. But it has been known to sort of affect different diseases and disorders in a way that researchers weren't even expected. As for thyroid disorders, this will cause your thyroid hormone levels to increase drastically. Now, ashwagandha affects you differently depending on the type of medication that you can take as well. Now, for if you're taking an immunosuppressant that's supposed to inhibit your immune system, this will actually know that effect and increase the activity when you don't want it to be an increase there. After surgery, it normally causes a decreased immune system response in patients, leaving them more vulnerable. Sedatives such as benzodiazepines will make it cause sleepiness and slow breathing. Sedative medications or CNS depressants are normally see patients have sleepiness and slow breathing. Anti-diabetic drugs that are supposed to help reduce your blood sugar levels, this will cause it to lower that blood sugar level. And if you're taking anti-hypertensive drugs that's supposed to help for blood pressure, This will lower your blood pressure to a amount that you don't want it to be for. So with that being said, the take home message is that you should be mindful about dietary supplements. Dietary supplements are do not have the same restrictions as drugs do. And this means that they are not approved by the FDA until there's something dangerous in them that needs investigation to be followed. Ashwagandha does have several side effects, but so far it has not elicited a response from the FDA to actually investigate it more, which is very disappointing. So be careful when taking these supplements. Don't take them longer than you need to, and always try to look for alternatives. So talk to your healthcare provider. Try to see how you can deal with your stress, your anxiety, and try to not be influenced by other people into taking it. Because as I mentioned before, there are a lot of side effects, and there are causes to believe that it can lead to liver damage. So please be careful and please be mindful. And these are my references. Thank you very much for listening to this presentation, and have a nice day.